Good evening, everyone. I'm Michelle Leifer, and I'm the director of the USDAN Institute for Animal Health Education at the Schwarzman Animal Medical Center. Along with my colleague Valeria Menendez, I'd like to thank you for joining us for tonight's event, Hip Dysplasia from Early Signs to Treatment Options with Dr. Nathan Cherzan. This webinar is for informational and educational purposes only and is not intended to substitute for professional veterinary medical advice, diagnosis, or treatment. If you have questions or concerns about your pet's health, we always recommend consulting your veterinarian. We'll be taking questions via chat, and we'll open the chat toward the end of the presentation, and we'll save some time to answer as many questions as possible. Tonight's event will be recorded and we'll send out a link tomorrow in case you miss anything or would like to share it with a friend. And now it is my pleasure to introduce tonight's speaker. Dr. Nathan Cherzan earned his veterinary degree from Washington State University. He completed both a rotating internship and a surgical specialty internship at the Veterinary Specialty Hospital, Sorrento Valley in San Diego, California, where he developed a strong foundation in surgical principles and patient care. Dr. Cherzan went on to complete a residency in surgery right here at the Schwarzman Animal Medical Center, where he also served as chief resident. Now a senior veterinarian in the surgery service, his clinical interests include joint replacement, trauma, and orthopedic surgery. Dr. Cherzan is dedicated to advancing surgical excellence through compassionate patient care, collaboration, and mentorship. And we are so grateful to have him with us this evening. Please join me in welcoming Dr. Nathan Cherzan.
Thank you, and very glad to be here. And I'm going to give it a shot here to share my screen, which might take just a second. See if I get the right one.
Okay. Good. Looks good.
That working?
Looks great. Yeah.
Great. Let me know if it doesn't advance here in a minute. But like she said, my name's Nathan Cherzan. Nice to meet everybody today. I'm going to talk about hip dysplasia, early signs, treatment options, and some other things that relate to hip and the hip surgeries. So did that slide advance?
It did, yes.
Perfect. All right. So as she went into a little bit about me. I just thought I had a fun little map to give you a little background because I bounced around the country a bit through my educational process and very happy to have landed here in New York City. But I started in Battle Ground, Washington, which is a small town just north of Portland, Oregon. I got my education a little bit there and then also at Washington State University, where I got both my bachelor's degree and then ultimately my veterinary degree. I then moved down to San Diego and did my internships down there. And that's where I kind of started the process of working towards primarily surgery. Over to New York City. And here we are now, senior veterinarian in surgery here at the Schwarzman Animal Medical Center. So very excited and happy to be here. Like you said, my focus is on orthopedic surgery, joint replacement. I'm really passionate about educating residents and using research and advancing treatment options here to ultimately give pets and owners better healthcare, better medicine options, in the city, which is great. I have a wife. I have a dog. This is them. My wife's Megan and my dog's Poppy. And then in the middle is something I do for fun, which is go hiking and climbing and those things. And this is me on Mount St. Helens, if anybody's familiar. Mount St. Helens is over in Washington and one of the volcanoes. That one's erupted, if you remember that from the late 80s. And just a fun picture. Now into the real talk. To talk about a little bit of an outline, I'm going to go into some relevant anatomy so we're all on the same page about what the hip joint looks like. And then we'll talk through the disease that we're focusing on tonight, which is really arthritis of the hip. Its behavior when we decide to treat that disease and how we do it between medical or surgical options. And then we'll go into some interesting, more complicated cases and some of the advanced technology we have available to us and that's kind of growing through veterinary medicine. So the hip joint is composed of the femoral head and the acetabulum, also called the ball and the socket of the ball and socket joint. The joint moves through a range of motion, both in flexion and extension. So if you imagine pulling your knee up to your chest, that's flexing your hip, and then extending your hip is pulling your leg backwards. but also gives that joint also gives your leg and pet's legs the ability to essentially move away from the body and rotate around the hip joint. So it's quite the versatile and high motion joint that's supported by a number of different structures. The ball, I circled in red. The socket or acetabulum, I circled in blue. And one of those really important structures is this orange line or the ligament of the head of the femur. Essentially, it's a structure that holds the ball in the socket and helps stabilize the hip joint so that it can essentially stay in position as they move through and use their hip and walk, run, play, etc. Over top all of this is the joint capsule. The joint capsule is a structure that basically contains the joint environment. So it protects the cartilage, the joint fluid, and the things that keep joints healthy. But it also does provide some support for the hip. So it gives some structure to the hip and prevents it from luxating or having a problem. The gluteal muscles, as well as many other muscles, but the gluteals are a big one, also support the hip and protect the hip in its position and also serve important function through range of motion and ultimately are an important component of surgeries and treatments we work around in the hip. We have to do some reworking and movement of those muscles to access the joint and do the work we need to do for some patients. So I thought important to highlight here. There's many other muscles that cross the hip and are important for both stabilizing it and its function. Those include the quadriceps, your hamstrings, and some other muscles that we don't have to go into too much detail on tonight. The hip should be a round, smooth femoral head or the ball again. It shouldn't have any big defects. There shouldn't be any excessive brightness or new bone formation, and we'll go into that here in just a second. And the acetabulum or the socket should be a relatively deep socket that contains the head of the femur and also doesn't have any kind of irregularities or changes or new bone formation. As you see in this x-ray, there's not extra bone sitting around the joint either. So if you take a look at it, there's a relatively smooth surface there that contains it, but you don't see other bright, shiny, bony components. When we get into hip arthritis, and these two were just examples. What we can see is that there's an irregularity or flattening of the head of the femur or the ball, which you see in both of these x-rays. There's also a shallower socket, and there's a better example of that on the left. So that socket or acetabulum is really shallow and doesn't really capture the head of the femur anymore. You can also notice that there's some new bone around some of these joints. So the neck or the kind of support post to the ball or the head of the femur is thicker. It's also brighter, and there's some new bone up in front of the acetabulum or cup, again on that left image. When we talk about hip arthritis in the context of hip dysplasia is the developmental condition that dogs and cats can get that ultimately leads to laxity in the joint or starts with laxity in the joint most often. And that laxity or incongruency between the ball and the socket of the joint leads to an irregular wear of the cartilage along the joint. And the cartilage is ultimately the important surface for joint health. Has a high density of collagen and allows for a smooth weight bearing and gliding or motion through the joint. Between those cartilage surfaces, there's joint fluid. Joint fluid essentially supports and provides buoyancy and a little bit of cushioning between the two surfaces so that when they're using their hip and moving around, running, playing, etc., they don't have significant contact between the cartilage. And it also provides some healthy kind of mediators and nutrients for the joint environment to maintain the health of the cartilage. When that's disrupted, as in hip dysplasia, like these two x-rays, what can happen is that we see this start of a cascade of an inflammatory mediators and destructive enzymes that they create inflammation in the joint and they can start to break down the cartilage surface. Sometimes the breakdown of that cartilage surface is the beginning of the process because it starts to expose the bone underneath the cartilage, and that can lead to this inflammation in the joint. Ultimately, when we see all that happen, we see these secondary changes that I was just talking you through there on the x-rays. So we see osteophytosis or new bone formation, which is what we see with that change to the neck or the support post of the ball, as well as the new brighter bone around the joint. We can also see brightening of the joint. So if you notice, it's sometimes subtle. But these two x-rays, the bone around the joint, or essentially of the ball and kind of along the socket, is brighter than of a normal hip. That tells us that there's wear of the cartilage and it's leading to inflammation of and brightening of the bone underneath. It's kind of like wearing down a tire or something like that. They burned through the cartilage a bit because of wear of their of their disease, and it's ultimately led to inflammation in the bone underneath and that brightness or change in the bone underneath. Causes of hip arthritis are many. Hip dysplasia is one of the most common and the majority of our focus of our talk tonight. Essentially, they develop this laxity in their joint when they're born. It's generally an inherited disease, and they move through their life and can develop arthritis secondary to that laxity or that change in conformation between the ball and the socket. Other things that can cause that include fractures. So if they're break their leg, or specifically break their leg around their joint, whether that's the cup or the acetabulum or the head or the ball of the joint. Um, there's also fractures that are associated with non-traumatic events. So while we see a lot of trauma and a lot of injuries here in the city and in kind of higher population areas, we also see patients that come in that have a fracture that's not necessarily associated with trauma. And I'll go into that a little bit more in detail in a bit, because that is most often associated with cats, though not always. Sometimes pets develop a change to their leg. So instead of a normal development in the shape of their bone, like what we've been looking at, sometimes they can have a change, like in the image on the upper left, that they essentially develop an abnormal angulation to the bone, and that can change how their limb is used. So it can change how they bear weight across their joint. It can also essentially change the weight bearing across the cartilage. So it leads to an abnormal wear and pressure, and ultimately, again, can lead to arthritis. Sometimes those bony changes present us with unique challenges when we're talking about surgeries to help correct and fix the pain in these patients. As an example that we'll go into a little more in detail, when we have to get into to install a total hip replacement implant, we have to put a component down into the femur. But to do that, we can't go through some of the important bone that's at the top of the femur. Instead, sometimes we have to move that around or do other kind of more advanced techniques to be able to accomplish the surgery and ultimately get the patient a pain-free functional hip. Some dogs that have hip dysplasia are severely affected. So they go on to be painful, lame, and limping, and they're having a hard time. And other dogs that have hip dysplasia and arthritis can do something like this. Hopefully this plays well. Yeah. So that was a little bit of a sneaky way for me to get my dog in again, because I think she's a fun one, but also a way to show you that some dogs that have hip dysplasia can go on and run and play and jump and live a normal life, even if they have arthritis. And we'll talk about there we go. And some dogs are affected. And so this is an example of a patient that was affected and limping. It's not dramatic, but it's there and visible. And as we work through this in patients, we have to determine how affected they are, how painful they are, and an important part of that is how they look at home. What we focus on is how lame or how much they're limping. We also look at how much muscle they have on each of their thighs and kind of along their back legs. Muscle mass is an important indicator of a patient's comfort and of a patient's use of their leg. So dogs that have stronger muscle mass, it essentially tells us that they're using their leg more and they're maintaining their muscle mass. As dogs get hip arthritis and they have a harder time with pain associated with their hip, they start to lose their muscle mass because they're shifting their weight either to their other back leg or to their front legs. We do a good physical exam each time we work with a patient and are considering different treatment options for pets to make sure that we're screening patients that have hip pain and we're treating them appropriately. Some pets come to us, and it may be visible for you at home that they have a lameness, just like what you saw in the video. And that lameness may not be an indication of hip pain, but of knee or another joint or of bony pain. So we work through that with our exam. You can sometimes pick up on some indicators of that at home if pets are licking or scratching at a specific area. Sometimes you might notice they're carrying a specific joint differently, and all those things are important as we're trying to sort through what might be causing a problem, for your pet. So what do we look for at home? So the first thing to think about, or that might trigger a consult or conversation around pain in a pelvic limb or specifically around the hip, would be lameness or limping. So if your dog starts limping, starts essentially having a harder time using a specific leg, that can be the first indicator or start of the conversation for, hey, we need to go get this evaluated and have a conversation about what's happening. Sometimes it's more subtle. So pain can present in many different ways in our patients. I'd love to be able to ask every cat and dog, hey, where do you hurt or what does this look like? But that's just not a part of this. And instead, we have to work through different signs that they might present us with. So sometimes that includes them just not wanting to do as much activity as they normally do. Sometimes that means that they don't want to play. They may have a decreased appetite or a less interest in interaction with you or with other pets in the household. In cats, it can be even more challenging. Sometimes they present with just a hiding behavior. They might just be sleeping more. So it can be really a subtle change sometimes at first. And then eventually, if something like a limping shows up, then we can hone in and have a better idea of what's going on. If your pet is presenting with some of these signs or having a harder time and it's hard to sort through, what's happening, then that's where you get a veterinarian involved and somebody takes a look to help localize, where that might be coming from and ultimately guide you towards treatment that's appropriate for your pet. Um, when we talk about activity looks different for every pet. So some cats are lazier cats or just like to sleep, and so their activity might be as limited as walking across the room to go to the food bowl, interacting with you for a little bit, and then taking a nap or perching at the window for the majority of the day. Other pets, active dogs or even really playful cats might be bouncing around the house all day. They might want to go on 10-mile runs. They might run at the park for hours. Every dog and cat looks different when it comes to their level of activity, but the important kind of component to this is seeing that we're seeing changes in their activity. They're starting to decline in their ability to run and play and do these things, or they avoid specific activities. Another important concept when we're talking about hip pain and hip arthritis is the management of each patient individually and not just because of their x-rays. While we ultimately treat a patient for hip arthritis, when we treat patients with hip arthritis, they often have significant x-ray changes. It's not always. So sometimes they have a mild change on the x-ray that actually indicates a pretty significant amount of pain that restricts their ability to do what they want to do or accomplish what your goal is with them. Other times they're really active, they have dramatic arthritis, like in this x-ray. So we can see that the head of the femur is abnormal, so is the cup, and we see this big change. But this patient may be running, playing, and comfortable and not having a hard time with their limb. So important thing to work through as we're evaluating these patients. Ultimately, we don't treat the patient, we don't treat the x-ray, we treat the patient. And so it's important to work through this with you. And, sometimes we have appointments with families who say, hey, my pet has, hip arthritis, hip dysplasia. But if they have great activity level, they're really comfortable, then the great news is they can keep doing that and may not need as much support as another pet. What we do is work with you to work hard to make sure we understand what's happening and how the quality of life of your pet might be affected by their hip pain or if something else is going on. There are predictive radiographic techniques or x-ray techniques. So some people, and including us, but many veterinarians use different techniques to sort of help assess the condition of the hip in younger patients, especially when we're working through breeding. So we use x-rays as a tool to say, is there hip laxity present? Is there hip arthritis present at a younger age to help determine if this might be a pet that can go on to have future generations and try to not pass down genes that might have, lead to the hip dysplasia in pets. These generally focus on assessing patients for the risk of that gene and if passing it down, as opposed to assessing if that patient's going to develop arthritis that is painful and affects their life. While we're working through that, and there's been recent, research and information to help kind of guide that, it's still something that we're learning to use, and it's still kind of challenging to ultimately know, because like we're talking about here, there's pets that can go on to develop this arthritis but may not need surgery, as an example, to treat their pet's arthritis. So every patient's a bit different, and ultimately, depending on your goals with your pet, just important to involve a veterinarian. You can talk through options, especially if you're going to go on for breeding purposes, to help kind of guide the next steps, and risk for hip dysplasia and arthritis in the future. When we talk about treating hip dysplasia, there's two pathways that we go down for dogs and cats that have arthritis. The first pathway is medical management. So medical management, we focus on the four kind of primary tenets of that is weight management, consistent controlled activity, joint supplements, and then pain management. Weight management is critical for any pet with arthritis, but it's also very challenging. Obesity in pets definitely leads to both more weight on their joints, which leads to more discomfort if they have arthritis or pain. But it also creates an environment that's very inflammatory. So there's a lot more inflammatory mediators present in some pets that have more fat on their bodies than pets that don't. So ultimately, we want to do our best to keep them around their ideal body condition score. And that this chart is an example of a body condition score. And essentially, it looks at some different indicators that you can feel and look at on your pet that include feeling their ribs, seeing a waist, looking at the tuck under their belly, all essentially ways that we can try to interpret if our pets are at the right body condition, a little too skinny, a little too heavy. I certainly have a hard time, as many of us do, giving my dog treats. That's something that we all do, and something that's very important for our bond with our pets. What's important is maintaining the amount of treats that we're giving them, and if they're at an ideal body condition, then you don't have much to worry about. And as long as you kind of maintain the normal amount of treats you're giving along with the diet, then you're doing a good job. If your pet does become obese or overweight, that's something that can happen as a result of changes in their activity, sometimes medical conditions. So, again, important to talk to your veterinarian about those. And also, just sometimes means that they've had a change either in their hormones of their life that's led to a weight gain. Once they've started to gain weight, we have to make modifications to their diet, their activity, in order to essentially ensure that we're giving them the best success if they're a pet that has arthritis, especially. Usually what that means is under a supervision of a veterinarian, you work with them to start reducing their diet. And the first step in all of this is to understand how many calories you're giving them and how many calories they should be getting. Your veterinarian can work with you to do the math and help kind of sort out how much they should be getting. And then what component of that are we feeding in treats? If the amount of that in treats is far superseding that of their regular diet or of their overall calorie count, we need to start to work that down or find different ways to do that, whether it's with low calorie treats or more activity. Speaking of activity, controlled activity is really critical for pets that have arthritis. And what I mean by controlled activity is that they need to continue moving. As we slow down with arthritis, we start to become more painful. We get sore in our joints, just like dogs and cats. And it's important that we keep moving and exercising to maintain our muscle mass, to keep ourselves strong, to keep our pets strong and healthy. But we can only do that to a point, depending on the level of arthritis present in our patients. So what's important is that when you have your dog or cat, if they have arthritis, that they continue going on their regular walks, because that's a relatively controlled, good amount of activity. And surprisingly, and especially in dogs, it's something that they can really build muscle and strength just with walks, as opposed to you or I that goes to the gym and has to put on muscle. I don't necessarily build muscle when I go on a walk, but when we do that with dogs, and especially dogs, they can really build their muscle. With cats, sometimes it's encouraging them to play, moving them around the house, that sort of thing. And ultimately, continued movement and use of their limbs is really important and helps promote a healthy environment for their joints. What we have to try to avoid in pets that have arthritis and pain in their joints is things like running after a ball, frequent jumping, or frequent running up and down hills, or jumping on and off furniture or higher surfaces. Those high impact activities can really cause a flare up of arthritis or pain in their joint. And that can set them back, slow them down for a period, and again, perpetuates that kind of challenging arthritis cycle. Joint supplements are a component of management of arthritis. There's many joint supplements. What I've listed here are some components of joint supplements. So glucosamine and chondroitin sulfate are two kind of long-term or long-standing components of joint supplements. Fish oil or specifically omega-3 fatty acids. There's many other components to these joint supplements that I wasn't the intention of this talk, but so I'm being a little general, but there's many joint supplements that exist on the market, and there's a lot of new and ongoing research, both at the AMC and at many other institutions, about joint supplements and their function and ability to decrease the inflammation in joints and provide essentially healthy nutrients and building blocks for a healthy joint environment. Ultimately, as you're making that decision, it's important to work with your veterinarian to decide which joint supplement might be best. And also just understanding the available kind of information from companies and from outside third parties about different joint supplements. Generally, they're going to contain some combination of these products as well as many others. There's no right or wrong choice here as a clear, this product is the best at this point. But there are definitely some products that are more trusted by some veterinarians than others. So something that's important to do your research on and talk to your veterinarian on as you're making that decision. Pain management comes into play when patients have pain, when they're limping, when they're slower, when they are affected after activity. So if you get back after a long walk, or you go on a run with your dog, or you go play at the park, and they have arthritis, and they come back and they start limping at home, that's something that might indicate we have to involve anti-inflammatories if they're not tolerating the amount of activity that we want to achieve with them. Anti-inflammatories are generally the first line treatment or pain medication for dogs and cats that have inflammation in their joints and pain associated with their arthritis. These are some examples of those medications. There's several others. And ultimately, we can think of them like ibuprofen or one of those medications that we use in people. These are different products that are safe for dogs and cats, and they're medications that we use either on an as-needed basis, meaning only after heavy activity periods or periods where they're showing us that they're painful, or chronically, meaning where we keep them on the medication for a long period of time or the rest of their life for some pets in order to keep them at a comfortable level and at the activity level that we want them to be at. Amantadine is another medication that we stir in to help with patients that have pain associated with their joints. It works through a different mechanism, but it's a good medication for chronic pain, and one that I like to use for pets when they're working through challenges with their arthritis. There are newer targeted medications, both for cats and dogs, that essentially target the inflammation in their joint. So they work to specifically target inflammation in the joints and in that environment. We've seen some promising evidence and promising outcomes with some of these medications. There's also some new side effects for some of these medications that are important to think about. So as you work through this, all this would be under the guidance of a veterinarian, but you'd work through this process with them, and you weigh the pros and cons of adding in different medications and whether or not we have to use a new medication to achieve comfort and good success with our pet, or if we can make a different modification and avoid a different medication depending on what's going on. And sometimes we get into things like joint injections, and ultimately professional physical rehab is a really important component of managing arthritis and pain associated with it. Um, and that's something that we ultimately can do with many different pets at many different stages of arthritis. But essentially, that all is focused on removing pain from their joint and getting them moving and active so they can build their muscle mass. For some pets, we have to move into surgical options. So either in the short term, instead of going down the medical management pathway, we shift and say this option is better or may work better. Or in the long term, medical management was working and now it isn't. Now we're painful or having a hard time. So now we move into surgical options for hip pain. The first option that's existed for a long time and actually started in people is called a femoral head and neck ostectomy. Essentially, that's a surgery where we remove the ball from the ball and socket joint. So we make an ostectomy, we essentially make a bone cut where that red line is to remove the ball and the neck, so the femoral head and neck from the femur. What that does is creates a false joint via scar tissue over time, and that scar tissue holds the femur in place, but also allows it to move and gives them range of motion and function in their hip. It's a surgery that removes the pain associated with bone-on-bone contact and removes the pain associated with arthritis for many patients, but isn't a perfect mechanical environment, doesn't kind of replace what existed as the hip joint. So what that can do is sometimes lead to a change in their gait. While comfortable, it might look different, whether they rotate their leg out, they use their leg a little bit differently. Rarely it can lead to pain in some pets, so we do the surgery and they ultimately have some level of discomfort. That's thankfully uncommon, especially when we're selecting the appropriate patients. And we focus on doing this surgery in patients that are smaller, and when this surgery is the correct one for that family and that pet. Total hip replacement is a true replacement of the ball and the socket from the hip joint. So we put in metal and plastic implants to replace the ball and the socket to give them a mechanical hip that connects the two bones essentially, and then try to replace what existed. These are usually made out of titanium. There's some high density plastic, and there's a couple different options for stabilizing the implants in the bone. So either we use bone cement or essentially a glue-like substance to hold the implants in, or we use what's called a press fit system with some modifications to it. That press fit system means we push the implant in and the bone holds it in place, and then the bone grows into that implant over time to stabilize it. Ultimately, total hip replacement has shown a lot of great success in our pets, both cats and dogs of lots of different sizes nowadays. And it helps restore motion and function in their hip. We get a good normal function in their hip in the large majority of pets. And within a couple of weeks, we've removed the pain even sooner sometimes after surgery from a patient that has hip arthritis. See if this one plays, but this is what a dog looked like oh, 2 days after a total hip replacement. So as soon as 2 days after, we see a dog that's while we're limping, we're walking, we're comfortable, and using our leg quite well. The total hip replacement isn't without complications, just like the FHO. So there's risks of things like hip luxation, of fracture or breaking the bones associated with the implants. We can see infections of the metal implants, which is something that we thankfully don't see very common, as well as all these complications. And we can see a neuropraxia or injury of the nerves around the hip joint, specifically the sciatic nerve. If you've heard of sciatica, that's focused around that nerve in us. Um, Ultimately, the large majority of pets go on to have no complications and a good success and outcome from total hip replacement. But there are these complications to think about, and we have to modify their environment to help ensure that they have a good recovery when they have either of these surgeries. That recovery looks like generally at least 2 weeks for their skin incision to heal, and at least 6 weeks of activity management, a lot more restricted leash walking, no running, jumping, playing, and then we start to build their activity so that their muscles and scar tissue and things can heal around their total hip replacement or their FHO. The recoveries again are slightly different, which I won't go into heavy detail on this evening. But they're both important considerations as we work through decision making around these two surgeries for cats, dogs, and patients of all sizes. Speaking of cats, cats also can get total hip replacements, and I've shown you some X-rays this evening that of that surgery. But cats also get FHO surgeries, so both again available and an option. Cats don't as often get hip dysplasia and arthritis, but more often get a fracture associated with the head of their femur, the growth plate through the ball, which I'll show you here on an X-ray. They ultimately, for total hip replacement, are a size-dependent situation, and there's continued new development of different implants to allow us to get smaller and smaller patients with total hip replacements. That fracture is called a capital physeal fracture. Essentially, there's a line here. I don't know if you can see my mouse, but there's a line that goes through underneath the ball that I'd circled earlier, and that should connect to the neck of the femur, essentially that post. And in this X-ray, you can see that there's a little bit of a sharp edge to the neck and the ball because there's been a fracture. Essentially, those two pieces of bone aren't connected anymore. There's a weaker bone there in young, more often male, sometimes female cats. And we can see this fracture of the growth plate, and that leads to pain just like a broken bone, and ultimately can be treated with one of those two surgeries or other options, depending on the patient. To go into some interesting other options or new technology that we've started to work with here at the AMC and other places. There's 3D planning and 3D printing that we've started to use for different scenarios that are more complicated than the average or normal case. So this is a kind of a rendering of a patient that had a femur that was a bit different. Essentially, they'd had a fracture of the neck of their femur, and as a result, the head or the ball had moved down the femur a bit, which made the approach a little bit more challenging or different, for this pet. What's really cool about these is that we can go on to print the bones and do the surgery in that plastic model, and also sterilize these bones and models so that we can have them on the table during surgery. It gives us a good three-dimensional idea of what we're doing in the operating room, and gives us a lot more visual access to the bone that we just don't have in surgery, because they have all their muscle and normal structures around them that we have to be careful of. So this gives us a way to be more accurate, and essentially gives us the ability to work on some more complicated situations to, again, ultimately help pets go on to get a good, comfortable use of their leg, and provide comfort for their hip. These are some examples of some more complicated cases. So the patient on the left, that's a pelvis, and that large kind of bony irregular area is the cup or the acetabulum. And this pet had a huge production of new bone around their hip, and that essentially makes our approach a little bit more challenging, but also the implanting or placing the cup can be a bit more challenging. And 3D printing allows us to have access to and a way to ultimately plan this and achieve good success with this patient, and a way to be more accurate. And that's the same for the pet on the right. That's actually an FHO surgery that dog went on to have a hard time with, and we were able to use a total hip replacement and revise that as a good option to provide comfort for them. In conclusion, hip arthritis can be caused by many different diseases. Hip dysplasia is a common one, but we see others. That severity of the arthritis on x-rays is not necessarily an indicator of function or comfort, so it's important to take into consideration how your pet functions, how they look at home, and if they're able to achieve the activity and do the things that you and they want to do. There's medical and surgical options for hip arthritis and hip pain. They're all very dependent on the patient's comfort, their ability, and the individual family. I always like to say that you know your pet the best. You're around them the most. You understand them and yourself, and what's reasonable for you. And we're here to give you information to make the best decision. Total hip replacement continues to show excellent and consistent outcomes for many pets, both in cats and dogs. There's other options that exist, and FHO surgery is a common one that's right for some families. And again, important to weigh the options as you make decisions for your family and your pet. I think I sped through things a little bit, but I'm happy to take any questions. And I'll hop out of the slideshow here.
Well, thank you. That was really wonderful and very thorough, and you explained everything so clearly. Thank you again for that. Everyone, the
Of course.
chat box is open now, so if you'd like to put your questions in, we have one so far. What is the role of stem cells and PRP in treating hip DJD?
Yeah. Stem cells and PRP, I lumped into a little bit the joint injection option. So joint injections we use for many different reasons, but PRP and stem cells we use essentially with the idea or goal of improving the joint environment. And there's new and lots of information or research about those products and their ability to help restore and improve cartilage surface. And the goal is to improve comfort, and hopefully slow down the need for something like surgery. So it's an option and it's available, and it's really individual dependent when we use it or why.
Okay, great. Other than change in behavior or gait, are there any changes in a dog's physical shape or appearance that might indicate hip arthritis or dysplasia?
Yeah. Most often what you might notice at home, at least in more significant cases, is you can actually see that their legs might start to get visibly thinner. sometimes one more than the other if they have a single side that's affected. Outside of limping and pain and changes in behavior, it's something that it can be very different for each pet, and it's a little hard to, predict for each individual pet how they might present with those things. But if you're noticing that they're not feeling well, something's off, and they're not doing well, then that's where we start exploring these things. And every veterinarian starts with a good physical exam, and that's a way to help sort out if they hurt somewhere.
Okay, wonderful. Uh, we have a question. I know everyone is very interested. I am as well in the 3D printing.
Yeah,
Just how is that implemented? If you could maybe talk just
yeah,
a little bit more about that. I think it's really
yeah, of course.
fascinating.
Yeah, so it's a newer addition to our hospital and something that's been gaining, really cool traction through veterinary medicine. I think it's been giving lots of different patients a lot of new access to better treatment. And the idea around 3D printing is, at least when we need it, when we feel it's necessary, we get a patient through a CT scan, essentially a three-dimensional X-ray, and that allows us to isolate out the bone. And in these softwares, we can isolate out the bone and essentially create a 3D reconstruction of the bone, so that we can go on to both manipulate it on the computer and then also print it through a 3D printer. And then we can do things like practice.
Okay.
That's on the simpler side. And there's also things we can do like make guides for surgeries. So we install guides that essentially are very specific to that bone and tell us this is where we're going to make a bone cut or place a screw, place a post to do something in a procedure. So they both help us feel more confident, practice, and visually see what we were working on in the patient better, but also can more accurately guide the location of our surgery and what we might be doing to the bone.
Okay. Yeah. Really fascinating.
Yeah,
Yeah. Um, okay. All right. How late have you seen hip dysplasia appear in a patient? And maybe we could
sure.
take these a little bit together. Are breeds or any breeds prone to it?
Yeah, so hip dysplasia has an interesting distribution. We see it often in younger pets, as young as 6 months to a year and a half, when they come in and they're significantly affected and painful. Or we see dogs in their older years, so they get into their, late teens or early teens, late in the 9, 10 to 13 or so year. Um, and sometimes into the really late stages of their life. And so it just depends on the pet and the development of their hip, essentially, and the severity of their arthritis. But either we see them in the younger population or in the much older population. Often, again, both arms of treatment are available. So medical and surgical options always are generally are on the table, but obviously we have to take into consideration the pet and their whole picture.
Okay. I guess, is there any benefit to early surgery?
It depends on the situation, but early surgery, the good news with most pets is that things like hip arthritis don't have a progression to a point that we can't do surgery in most cases. Now, there are times where the longer we wait, the more significant the challenge is to do something like a total hip replacement.
Yeah.
Generally, these are pets that are affected, and you're starting early with your veterinarian, or at some point that we see them affected, we're evaluating them, and we talk you through that change. It's uncommon I run into a pet that's just found out they have hip pain and hip arthritis. They come to their veterinarian, and it's not like we've waited too long in most pets. So um, it's something where even with significant arthritis, even with significant change to their bone, both surgeries remain an option. And really it comes down to their comfort and how affected they are. And if they are uncomfortable and affected, then we can do that surgery even in patients as young as 6, 7, 8 months of age. It just depends on the specific situation.
Okay, great. Any thoughts on using laser treatment?
Yeah, so laser, and there's things like a CC loops, and there's shockwave therapies and acupuncture, and all of these things are great tools that I've used, that our physical rehab team uses. And the idea is we take these different approaches to decreasing the inflammation in their joint and around their musculature in a way to help improve their comfort. And I don't have a specific arm of any of those treatments that I would say this is the absolute best for this specific situation. But what I've often seen is that all these things together in pair, in tandem with a physical rehab team that's skilled and knows what they're doing, can really improve a pet's quality of life and comfort. So absolutely a component for some pets to use laser.
Okay. Let's see there. If a dog is older and has chronic arthritis now in the hip joint, what is the recommended path? I guess it would kind of depend, but is there
Yeah,
any?
if they're essentially if they're painful, if they're slowing down, if they're not doing what they used to do, or not doing what they want to do, like let's say they love chasing a ball and that's the thing that they're not doing anymore, and they're affected, then it's time to talk about treatment. And again, the treatment is medical or surgical, and really very dependent on the pet and what options are available for them. Um, but always the right time to talk to your vet and make a plan with them, especially if you're seeing that your pet is, limping, painful, changing in their behavior.
Okay,
Yeah.
great. How is leg par related to hip dysplasia? Is that
I think I have a feeling that's about leg calf perthes disease,
mm,
or essentially it's a necrosis of the head of the femur, and it's related to. We often see it in smaller dogs,
mhm,
but it happens in many, and we see it as this big kind of painful change to the head of the femur. So the ball starts to degenerate and becomes very painful, and generally it happens in younger pets. When we see that happen, then that is absolutely a disease that we've treated generally surgically, because often pets are quite painful from it. But we can do things like total hip replacements or FHOs for generally dogs that are affected by that disease.
okay. Does this affect the front or the front legs?
Thankfully, well, yes and no. So, isolated arthritis, mostly in dogs, anyways, doesn't necessarily impact other joints, and that the inflammation isn't happening in other joints just because it's happening in one. I know in people, and honestly, we're appreciating it in cats, that we get generalized arthritis. So we see inflammation in many joints as we age. Um, Dogs that have hip dysplasia and cats that have hip dysplasia, they start to shift their weight to other parts of their body, and really that's their front legs if they're affected in both their hips. And so then they start to carry more weight on their front legs, and then we can see an exacerbation of either pre-existing condition, or they can start to become sore in their front legs if they have arthritis, like generalized arthritis, like in a cat, as an example.
Okay. Are there any useful preventative activities? Maybe any activities to avoid as well?
Yeah, I would say that any dog or cat should and can live their normal life and run and play. If you have a, young pet that's normal and you're just looking to the future to try to prevent a problem, the biggest thing you can do is keep them at a good body condition, keep them moving, active, and keep, again, really important to just keep them at a reasonable good weight.
Mm,
And as long as we're doing that, there's not a huge body of evidence to say that there's another specific thing to do. Some families consider joint supplements, and again, is a good conversation to have with your veterinarian, but it's not something I personally recommend just for every dog as a blanket tool, as opposed to for pets that I think are at risk for arthritis or developing it down the road.
okay, great. Is there any way to slow muscle atrophy in older pets?
Yeah, muscle atrophy generally is an indicator of pain or dysfunction in their legs, and sometimes is just a reflection of their use of the leg. So maybe they've decided to offload it to another leg, or they're shifting their weight, but they're still comfortable because they've done that. Um, if you start to see that your dog is decreasing in their muscle mass in a specific leg or both their legs, the biggest things you can do is try to help control their pain with medications, with joint supplements, and those things, and keeping them active. Now, I don't say that in meaning that you would push them to be more and more active despite them wanting to stop or being uncomfortable. It's more getting them to a point that they can be comfortable enough to do, enough activity to maintain their muscles. Again, that's also where our rehab team comes in, because they have things like water treadmill and other tools to really, exercise and build their muscles in a way that they can have success too.
Okay. Any thoughts on braces?
Braces are challenging for the hip joint. So some braces can work great, and I use them frequently for lower limb injuries, so ankles and wrists and those things, depending on what's going on, but often with instability in some joints. But for the hip, it's really challenging to isolate or restrict the motion in the hip, or support motion in the hip in a way that provides them benefit. So I haven't seen and haven't used braces around the hip much.
Okay. Is shaking in the back legs a sign of hip dysplasia? Could it be?
It could be, though that is surprisingly common and quite a general symptom. So It can
Hmm.
be as much as discomfort. It can be as much as I'm cold. And sometimes it means that they're getting weak from something, and that something might be that they're on a medication. Things like anxiety medications that I use commonly for pets after surgeries causes them to shake in their back legs sometimes, and doesn't necessarily indicate a problem, but maybe a change to their change to their limbs, change to the way they're able to support themselves. So, very individual dependent there.
Okay. Do you still do TPOs on immature dogs with severe hip laxity?
So TPO and DPO surgeries,
Hmm.
or triple and double pelvic osteotomy surgeries, are used to essentially change the conformation around the hip. So it improves coverage and tries to capture the joint in a way that they don't have, or it improves the laxity to try to slow or stop the progression of arthritis is the goal. It's something that I've seen and been involved in and done over, my training and time, but not something that we do all that often for a couple of reasons. And really, the biggest reason is it's extremely challenging to catch the right pet to do that surgery before they've developed arthritis, because the key is they haven't developed arthritis yet. So it has
Okay.
to be a very early and preventative surgery, and generally quite young patients. But something that's reasonable to discuss, and for the right pet is something that's an option, and generally you're working with a veterinary surgeon to make that decision.
Okay, great. Are IA injections challenging for hip dysplasia patients?
They can be technically challenging. So the hip joint can be a little hard to access with a needle, or to inject a joint, but is something that we thankfully can accomplish, and we have tools to make that happen.
Okay, great. And just for everyone, some of the questions are very specific to an individual pet, which we can't answer in this webinar. So I would just, if I'm skipping it, that's why. I'd encourage you, obviously, speak with your veterinarian or make an appointment. But thank you. Let me see. Are any other questions? I think I got them all.
Okay.
Very thorough. Wait, hold on. Of course, every time I say that, then we have a couple of other ones.
Yeah, yeah.
What about prednisone? Um,
Yeah, steroids are another form of an anti-inflammatory. So sometimes, for again, specific reason, depending on the pet, we'll use a steroid instead of an anti-inflammatory or non-steroidal anti-inflammatory. I mean, so that's an option, and sometimes used for the right situation. And we both use that as an oral medication, and sometimes we inject steroids into joints, though uncommonly because it could be damaging to the joint. But for the right case, we can use it.
okay, and many people saying thank you for this great presentation, which I say as well. And
Yeah,
then we have
thanks for
one,
having me.
please let Nate know that Rachel's mom said hi. And, so Rachel's mom says hi.
Oh,
Okay, well, thank you so much. This was
of
really
course.
wonderful, really great. And just a reminder to everyone that we will send out a link to the recording tomorrow. And we can watch it again or revisit anything. I know everything went by very quickly, but I think it was very thorough and informative. So thank you again, Dr. Cherzan. This was really terrific. And just for everyone, we appreciate you being with us this evening. And just on behalf of the USAN Institute and AMC, we wish you and your loved ones a warm, safe, and very happy Thanksgiving. So enjoy the holiday and have a wonderful rest of the night. And thank you again.
Yes,
Okay, take
thank
care,
you. Have a good night,
everyone.
everyone.
Thank you.